bonjour, bonsoir. Ça dépend de qui côté vous attendez nous et à qui vous attendez nous tout. Non, pas M. Fredner Janak, your financial advisor. Today we have a special guest with us, which is Miss Zuliani. So today we have a special show for you who are listening all over the world in Palm Beach County, in Boynton Beach, in Orlando, Miami, Broward, okay, all over the place. So we thank you for listening to Achievers Financial Education. Remember, we all over the platform, social media platform. We have Facebook, YouTube, and Instagram. So we're happy to have with us today Ms. Zuliani. We're gonna talk about Medicare. I know a lot of you may not know, the benefits, some benefits, how to take advantage of, some benefit. We're gonna discuss things that you need to know, especially our seniors, okay?
Yes.
So, Ms. Zuliani, how are you?
Bonjour, bonsoir, Fred. Merci pour l'invitation aujourd'hui.
Très bien.
Je m'appelle Yvette Zuliani, pour l'audience.
Très, très bien.
And now I'll speak English.
Interesting.
Yes. Je parle un petit peu en français.
Un petit.
Yes.
Tout petit.
Tout petit.
Okay.
It's my pleasure to be here with you today to help your
Definitely.
audience understand at least, the basic lining on how to start with their Medicare and Medicaid benefits.
Awesome. So tell us a little bit about yourself. So,
Well, I've been in the Medicare industry for almost 15 years now.
15 years.
Yes, and I have to say it's been quite the blessing. I have enjoyed throughout the years helping the community to learn and understand how to navigate and use their Medicare benefits. Today, I do not practice as a licensed insurance agent in the state of Florida. I'm currently the broker relations manager for clinical care medical centers here in Miami, Orlando, and in Tampa. My responsibility is to have relationships with agencies such as yours and Marie Michelle, and the insurance companies as well. So today I'm working on the other side of Medicare, which is with the healthcare providers.
Awesome.
Yes.
So my first question, actually I'm gonna ask you some questions
Yes.
based on our listeners' point of view.
Absolutely.
So what is Medicare?
Excellent. So Medicare is a benefit that you accumulate throughout the years with your Social Security taxes.
Okay.
So every time you receive a paycheck, there are several types of taxes that are deducted from your paycheck. And one of them is Social Security.
Okay.
If you are a 1099, an entrepreneur, and you have your own business, then you independently pay your Social Security taxes either quarterly or at the end of the year to the Department of Social Security. Right?
Okay.
And that's where Medicare begins.
Okay.
Medicare comes in two parts.
Okay.
Part A. Part A, which covers hospital expenses. And that is something that you receive automatically when you turn either 65 or you decide to start receiving your Social Security benefits at the age of 65. And nowadays, it's a big trend to retire at 66 and 4 months because there are some benefits to that. As long as you have worked a minimum of 10 years and or paid into 40 quarters of taxes, then Part A is covered.
Okay.
Part B is your doctors, is what covers your doctor's expenses. And Part B is $164.80 per month that is deducted from your Social Security.
They're not gonna feel it.
You don't feel it because since that money really never reaches your pocket, it just deducted. So for example, if you have a check of $1,000, then they deduct the Part B from your check and you receive the balance automatically deposited into your bank account.
Okay. So you just said the Medicare comes with two parts.
That's correct. Part
Part
A
A
and Part B.
and Part B.
Correct.
Okay, so can you just explain a little bit again what is Part A and Part B? You just explained it, but I feel like you go too fast. Can you go a little bit?
Okay.
You know.
Yes. So Part A is your hospital expenses. Okay? So you know when you go into the hospital, you have a deductible that you have to pay. Sometimes you have to pay a certain amount of that hospital bill. So Part A covers your hospital expenses to a certain degree, depending on the health plan that you're in, right? And then you have Part B, which is your doctor's cost, your copays for the doctors, for your specialists.
Part B, most likely you said it's clinical.
It's clinical, that's correct.
Correct.
It's your doctor's benefits, that's correct. And so that is not deducted from your, well, it is deducted from your Social Security. And again, as you said, you may not feel it because if you have if you receive a check of $1,000 just for the sake of giving a specific number, they deduct the Part B cost, and then you receive the balance is automatically deposited into your bank account.
So there's another part called Part D, is what you call supplement.
No, Part D is our prescription drug plan. So when you enter into Medicare, you have Part A and Part B, which are your Medicare benefits. And then there is a Part D, which is your prescription drug plan. Just because you've entered Medicare and you started receiving your benefits, you have to now buy a Part D, a prescription drug plan. And it's something that it's not clearly said, but it is understood that once you enter into Medicare, you have to have a Part D. Now, if you do not want to have just a Part D, most men do not want to have a Part D because they're healthy, they don't take any medications, and so why pay for a prescription drug plan, right? They don't think it's necessary. So we have Part C. Part C stands for complete because it includes Part A, Part B, and Part D. Most health plans have a 0 monthly premium. Some health plans may have a small premium depending on the company. And so that includes everything. It includes your doctors, your hospitalization, your prescription drug plans. And what it includes is a structure of cost. Right? So the health plan may have a 0 copay for the monthly membership, but you have copays to see your primary care physician, you have copays to see your specialist, you have hospitalization copays, you have skilled nursing facility copays, physical therapy, and then your prescriptions falls into a portion of your benefits, and your prescriptions come in different tiers, in tier 1, 2, 3, 4, and 5.
What you call tiers?
Yes, so some prescriptions are generic, so they fall into tier 1, which most likely they may be a 0 copay, and so you have tier 2 is formulary and non-formulary, and tier 3, every medication falls into a certain category, a specialty. So some medications are more expensive than others. Some have reached the generic part of their existence and fall into a smaller copay price point.
Let me tell you something that we hear often in our community. Okay, so we talk about Asian community.
Yes.
So sometimes you talk to someone, probably he's or she's about to turn 65, or she just turned 65. When you talk to them, they said they already take care of everything for me. I went to Social Security, they take care of everything.
Yes.
So is that what they should do after, going to Social Security? What they should do? What should come next?
Yes. So once you've reached out to the Department of Social Security and you've informed them that you want to activate your Part B, because you're not obligated to take Part B if you are going to continue to work, right? And if you're going to continue to work and you fall within a certain income, you can then activate your Part B or accept your Part B, but you have to select a health plan. Okay. There are many health plans in each county, and they vary per county and per state. And so that's where you need to know what your needs are. And this is a key point. You need to really speak to a licensed insurance agent that is certified and is up to date with what the guidelines are, and now entering into 2024. For example, Mary Michelle, should reach out to her. You know, it's in my years of experience, I've always advised the community, find an agent that lives and works in your community, in your area. Someone that you can develop a relationship with. I have a relationship with many people that have been my clients for over 11, 12 years. And it's been a pride of mine to actually make sure that they're well taken care of.
Okay. So basically, when they go to Social Security, they most likely activate for them the Part A. No. Automatically, is that what you mean?
No, the Part B.
The Part B.
The Part A is automatically if you have worked a minimum of 10 years or paid into 40 quarters of taxes, right? So some people have only been in the country for 6, 7 years, and they turn 65, but they haven't worked a minimum of 10 years. And in that time frame, maybe they haven't paid the 40 quarters, right? So then they don't qualify for Medicare. And if they want to qualify for Medicare, then they have to pay the Part A and the Part B.
Which is most of the time they don't.
Exactly.
They don't meet that. They can't meet
This
that
is why
requirement.
it's important to have a local insurance agent, such as Mary Michelle, that can guide them the right way. As I said, you know, the stipulations for CMS are guidelines that we have, but they apply differently for everyone because everyone's situation is different. We can both be turning 65, but my situation is different than yours, right? Maybe I've made less income and you've made more income, so you've paid more taxes in a shorter period of time because of your income.
Wow.
Is that clear?
Very clear. But let me ask you again. You just mentioned about the importance of working with a local agent.
Yes.
Someone that you can call, that can come and sit down with you.
Absolutely.
And someone that talks your language.
Absolutely.
Can you
yes.
go a little bit over the benefit
yes.
of having someone that you can call, you can build relationship with?
Yes.
So
CMS,
I think our listeners would be more than happy to hear more about that.
The Center of Medicare Services requires insurance agents to certify every year on the changes of Medicare. And every insurance company that they are contracted with also requires that they do a certifications on those specific benefits for that particular company.
Yes.
So there's some, you know, homework and legwork and education that the agent has to have in order to effectively guide their clients. So, you know, why call a 1-800 number on a television prompter where you can speak to someone within your community? But it is also the consumer's responsibility to know what their needs are. You cannot just walk into an appointment and say, well, help me because I don't know what I need. So what are the things that you need to know? You need to know, who are your doctors? Do you have specific doctors that you see? Do you have a specific medical condition that you require some special or additional services, right? What are your medications? You know, what type of medications do you have? Do you take one medication, 10 medication? What are the dosages of that medication? Do you take it twice a month, you know, or 30 pills a month, 60 or 90 pills, depending on the prescription? And then there's also other benefits to knowing what your needs are. Do you want to see a private doctor, or do you want to go to a medical clinic? Right? So there's a lot of information that you as the consumer should be responsible for knowing, so that someone can guide you correctly.
So, so thank you for listening to our show this afternoon. Today, once again, we have our special guest, Mr. Zuliani. So she's here to give us some great information about Medicare. So, Ms. Zuliani, you just mentioned Medicare. We have Part A and Part B.
Correct.
And you said Part C.
Yes.
Okay.
Which is the Medicare Medicare Advantage plans.
The Part C, you said included the Part A and Part B and Part D.
Correct.
Is that correct?
You're learning well.
So I'm learning fast.
Yes, you're a fast learner.
Thank God. I'm learning fast. Thank you. Yes, but which is the question that what is our most concern?
Yes.
Is when people say they go to Social Security. When they go to Social Security, so-called Social Security, what they do for them?
What they do is they activate the Part B.
Okay, and about the Part A?
And the Part A, if they've worked the minimum of 10 years and or paid the 40
They
quarters.
activate the Part B and Part A.
Correct.
When exactly they need to talk to an agent to probably...
Well, these benefits should be activated at least 90 days prior to your birthday. Okay, because they have an initial enrollment period, which starts 3 months before their birthday, the month of their birthday, and 3 months after their birthday.
Let me say that it's important.
Yes.
They need to hear that again. You said they need to activate, okay, the Medicare plan.
Medicare benefits.
Medicare benefits.
At least 90 days before.
90 days before, 90 days after.
Exactly, before the month of their birthday.
Of their birthday.
Because their Medicare benefits become effective day 1 of the month of their birthday.
What happens if someone, we have met these people, they, feel like they're healthy, they can continue, working, they don't care about, whatever, go to, fill out, they have a good job, they feel like, okay, they don't care, they don't pay attention, they just continue working. What would happen to these people? It's very important for...
If you have credible coverage, what is credible coverage? If you work for a company that offers you group insurance, that is credible coverage.
Okay.
But it has to be a whole insurance, not just a prescription drug. You have to have a whole insurance plan.
Okay.
So if you have Medicare insurance, if you have private insurance through your employer, then you do not need to activate your Part B.
Your Part B.
Yes, but you still have to call Social Security and say, this is Yvette Zuliani, this is my Social Security number. I will not be activating my Part B because I will continue to work until the age of 66, 66 and a half, 67, and my current employer offers me full coverage.
Wow. And what would happen if they don't do that?
Well, they'll start receiving tons of mail from Social Security.
Okay.
And asking them if they're going to activate if they're going to accept their Part B.
Let's say after 90 days pass.
Yes.
If after 90 days pass.
Surprisingly enough, people receive a mail and don't even open it.
Yes.
And then, Social Security is trying to communicate with them so they can inform them of what's going to happen because they don't know that they have health insurance. Yes.
Yeah. But I've heard that they have penalty. Is that correct?
There's penalties.
If they don't, activate the Medicare after 90 days. Is that correct?
No. So there's some penalties if you enter into Medicare and you do not accept a prescription drug plan. Because you have to have your Part A and Part B. You can have traditional Part A and traditional Part B and not be enrolled in a health plan, but you have to have a prescription drug plan. If you do not have a prescription drug plan, after a period of time, Social Security will have a penalty, which is usually about 1% of the national average cost of a prescription drug plan.
Okay, that 1% is going to be for how long?
Forever.
Forever.
Forever and ever.
So
let's say that 2 or 3 years later, right, your medical condition has changed or you're no longer with that employer, and now you call Social Security. Now you're 69 years old and all of a sudden you have a medical condition and you need to have health coverage, right? You call Social Security, and at that time they will activate and you can accept your Part B, but that penalty for not having a prescription drug plan from the inception, from the moment you qualified for Medicare, will stay with you forever. And that it could be 50 cents, it could be $2, it could be $3, it could be $20, $30. It's, the formula is made up by Social Security, and when you receive that letter, it'll tell you how much that penalty is, and that penalty will stay with you forever.
Wow, you said
now one
forever.
thing that people can do is log on to Social Security, ssa.gov. You create an account with Social Security. You create a username and a password, and it will tell you what is on your file, what corresponds directly to you. How much taxes you've paid, when you qualify, if you have enough taxes paid to cover Part A, if you have enough taxes paid up to cover Part B, and it'll give you an approximate of how much your Social Security check may be.
Wow.
Now, just because you've done the preliminary work of reaching out to Social Security, there's still other steps that you have to take, like either getting a prescription drug plan or enrolling into Medicare Advantage plan, which is the Part C, right? And that's where the advice of a insured license like Mary Michelle can help them look at their basic needs and guide them in the right way as to which may be the most suitable plan for them based on their needs.
Wow, wow. But let me ask you.
You can't do it alone.
Okay.
You cannot, some people can figure it out on their own, but why guess when you have a licensed professional that can guide you correctly? Yes.
Interesting. But that amount, is that fixed or it's accumulate that penalty?
The penalty.
Is that a fixed amount or it just keep accumulating?
No,
every
once
year?
the penalty is imposed based on the length of time that you went without a prescription drug plan, that's it.
Okay.
It's just whatever that number is. But it will be with you forever.
Forever.
It does not have an expiration date.
Now, can you go back a little bit, what they need to do? Because we have a lot of people listening right now. They want to know what to do to avoid that penalty.
What you need to do is call Mary Michelle so she can have an appointment with you. You have to sign a scope of appointment so she has the ability to speak to you and guide you and advise you correctly.
When they need to do that? You said 90 days
At
before?
least 3 months before their birthday.
Or
the month of their birthday or 3 months after their birthday.
No longer than that.
That's the window that Social Security gives you so that you can put your affairs in order. Right? So let's say that it's my birthday is this month, the month of October, and I didn't do anything these 3 months prior. And then in the month of, and I have no health insurance. In the month of October, I am active, October 1st, right? And you're sick or you get into an accident, you need medical help, right? But you haven't activated your Medicare benefits, right?
Wow.
So you're responsible for 20% of all of your medical expenses.
20%?
That's correct. And there is no limit to that 20%. And you decide, well, okay, so now I'm going to put my affairs in order, and Social Security will allow you to email or fax them your medical bills, and then they decide what portion they will help you cover for that cost.
Okay. Okay. So
it's a lot of information.
A lot of information.
It's a lot of information, and that's why I say, why guest? You don't do this alone.
Wow.
The best thing that you can do is definitely call the Department of Social Security or create an account at ssa.gov, and you can look at your own personal file, and it'll tell you exactly where you are, right? And if you are going to retire or not work, or work but fall within a certain income, then you'll take the necessary steps to get things started. Yes.
So we're gonna say a few words in Creole.
Oh, okay.
Because we have our people.
Parfait. Parle en créole.
Ok, pour en pile nous captons de nous. So, ça Madame Zuliani so dit qui capable paraître un petit crasse compliqué pour en pile nous. So pour simplifier li, n'a demandé ou pour capable relayer Madame Marie-Michel Jean-Just, c'est une spécialiste nous gagne dans domaine ça qui capable aider nous. Nous capable relayer dans 786 916 61 93. So, nous sommes capables de joindre Madame Marie-Michel dans le numéro ça qui est capable d'aider nous, guider nous, orienter nous pour éviter que nous ayons une pénalité pour la vie. Tant que Madame Zuliani so dit, si vous pas fil Medicare, plan Medicare avant 90 jours, qui avant date naissance ou bien après 90 jours, ça veut dire 3 mois d'avance avant date naissance ou bien 3 mois après date naissance pour éviter qu'on ait une pénalité. Et pénalité ça, d'après ça, Madame Zuliani se dit, c'est une pénalité qui est là forever, for life. We just mentioned about the penalty, how to avoid it.
Exactement.
You're going to learn some Creole word. You're going to learn some Creole word.
Yes,
so
I would love
to. We need to teach you some
I would
Creole.
love to learn, yes.
But talking about Creole, I know you in the Asian community.
Yes,
Yeah.
yes.
Would you say a few words about the clinic? We visit your clinic recently.
Yes.
We see we have a great, a nice clinic over
we
there.
have, Clinical Care has 25 medical centers between Orlando, Tampa, Palm Beach, Broward, and Miami-Dade County. In this community, we have a clinic that we call, a medical center that we call North Miami West. It's located at 12625 West Dixie Highway, 33161.
It's very close here.
Very close.
So it's in the middle of Asian community.
We have 2 doctors that speak both English, Creole, and Spanish.
Oh,
and the
okay.
majority of the personnel there as well is either Creole or Creole descent. And so we have nurses and front desk. We have the doctors that speak, Creole to make the community comfortable. And that is one of them. We also have North Miami East, which is just down the road from there, that also has Creole doctors, Haitian doctors that is able to take care of the community. And it's important, right? Because if you're a senior and you walk into a medical center and your doctor does not understand, what your ailments are, it takes a little while to between sign language and symptoms for them to understand what you're saying. So we've taken care of that, and we have a whole community of medical staff at the center that will take good care of them. And if you would like to tour that center, I welcome you to call Mary Michelle. She will take you to the center, introduce you to the doctors, and give you a tour of the benefits and services that we offer there.
Absolutely. Let me go over a little bit. I like being,
thorough. You like being thorough.
You just said we have doctors that speak Creole there.
Yes.
The
They're
Asian doctors.
Yes.
Asian doctors.
That's Haitian nurses
our
as well.
Seniors could feel more than welcome, comfortable to talk Creole.
Yes.
Okay, the language.
Yes.
With their own doctors.
Yes.
Is that what you mean?
That is what I mean.
Okay.
Yes.
Okay. Cool. So the last thing I would like you to give you the opportunity to say whatever you want to say to the community.
Excellent. Well, what I have to say, October 15th, which was yesterday, through December 7th is the annual enrollment period. This is the opportunity that you have to look at what the benefits for next year look like. There are a lot of changes this year with Medicare benefits, and many insurance companies have updated and changed their benefits for next year. So, I would say, even if you decide to stay with your current health plan, it would be a good idea to meet with a licensed professional that can advise you whether or not there's some changes, some benefits, or another health plan, or within the same company, another plan that may better benefit you based on your current needs.
You just add something.
Yes.
Even they already in a plan.
Yes, if they're
already in a plan. Let's say someone who's listening right now, they already have made the plan for the past 3, 4, 5
years,
10 years.
Yes.
So they can call.
Yes, they should call a licensed professional, such as Mary Michelle, Madame Mary Michelle, and have a consult with her. And she will go through all of their benefits. She will review all of the doctors. She will review all of their medications. If throughout the years, they have a medical condition that they are looking for special attention or a specialist for that, she can review all of that. Sometimes the best thing to do for a client is said, you are well where you are. Your health plan is not going to change. I think you're okay with staying here. But there are a lot of changes that are coming for 2024.
Okay.
So this is definitely a year that you want to review your current benefits and what they may look like next year as well.
Awesome.
Yes.
Awesome. Anything else you want to add?
No, I say merci. And I look forward to doing this once again with you and educating and helping your audience understand their Medicare benefits.
Awesome. C'est à moi de vous remercier, Madame Zuliani.
Merci à toi aussi.
Merci. OK, so nous sommes contents parce que vous avez tant de nous. Merci pour tant de mettez pour tant de nous. Jeudi, nous avons porté un spécial capable de show pour vous-même. Jeudi, nous avons avec nous Madame Zuliani, qui sont spécialistes dans Medicare. So, qui dans business Medicare for the past 15 years?
Yes.
For the past 15 years. So, pensez que un show après-midi est un bénéfice pour vous. Nous demandons pour mettre un comment ou bien subscribe dans une plateforme, either Facebook, YouTube ou Instagram. Merci en pile parce que vous attendez nous. Merci pour le temps que vous mettez pour attendre nous. À la prochaine.
À la prochaine.